A lot of patients come to see us because they've seen other people in the past, and part of the reason they see us is because of our unique and extremely in-depth examination process. And we break this down over 2 appointments. The first consists of the consultation. That's understanding what your problem is, how long it's been there, why perhaps other treatments haven't worked, and really getting to the grips with the origins of that problem and your problem. The second step is we do a detailed examination of our own here in the clinic, and that's special orthopedic testing as well as range of motion tests and many others to establish, one, where is the source of the injury, where is it affecting, say, any radiations that may go down into the legs or into the arms in the case of neck and back pain, and also what factors are limiting your recovery. From there, we'll then send you on to get scans done. Now, most people with back pain and neck pain, as you probably know by now, our clinic's primarily treating those conditions, will have some degree of issue in weight bearing. So our scans will reflect that, understanding how does your spine weight bear when you're upright. So the scans will be upright, and we'll arrange those for you on the same day. Now, subsequent to that, we'll do any necessary treatment using some of the technologies that are behind us here and in the other room as well, to help give you a little bit of relief in that first instance. Sometimes that can be a lot of relief, but it really depends on how long you've had this issue as to how much relief you're likely to get out of that first session, but it's also a little bit of a taster of what the treatment's like. Subsequent to that, you'll go away, you'll get your scans done, we'll get the results back. Now, there's 2 reports that we do from this. Number 1, we get an independent radiology report. So that's an independent practitioner outside of our clinic that we work closely with, and they will look at your x-rays to understand, is there anything nasty going on? And also, 2 eyes are generally better than 1. Then we generate our own report, fully understanding specifically what's going on in your spine, what's caused the problem to not perhaps recover effectively, and what can we do in certain instances to change that so you can recover properly and fully. We'll then put those in a report, like these ones behind me here. These ones we've got to go through for the rest of the day, and go through that when you come in for your next appointment. So we'll go through the written report and also go through it properly on screen so you understand specifically what's going on, especially with a longer history of a problem. You need to understand what you're doing at home, what your body is doing, to understand what you may be doing that's making it worse, and do more of what's going to make it better. And finally, we'll put together a specific treatment strategy involving, again, some of the technology that we've got in here and next door, as well as rehabilitation plan to deal with that problem that we've identified, or the underlying causes of these problems, and make sure that you recover properly this time. You know exactly what you're in for, exactly what rehabilitation is required, and a clear direction to get recovered.